Hello, my name is Brittany Atkerson, and I'm doing my presentation on diabetes mellitus and COVID-19 in the state of Georgia. I'm currently a resident of Georgia, which is why I chose this population. So there are three categories of diabetes which will be discussed further. They are type 1 diabetes, type 2 diabetes, and gestational diabetes. So let's start off talking about prediabetes, aka borderline diabetes. This is characterized by high blood sugar levels, also known as hyperglycemia, but these levels are not high enough to be at diabetic levels. And this is shown with an elevated hemoglobin A1C of 5.7% to 6.4%. Adults with prediabetes have a higher risk of developing type 2 diabetes. Lower awareness and education rates compared to diabetes 1 and diabetes type 2. So with prediabetes, there are people who, may not understand that prediabetes exists. They may think, oh, okay, well, my hemoglobin A1C was high, but I'm not a diabetic. That means they are a pre-diabetic. So it's a term that's not as well known as its brother and sister, diabetes type 1 and diabetes type 2. Type 1 diabetes is also known as insulin-dependent diabetes. Individuals with type 1 diabetes are unable to produce insulin due to their immune system attacking and destroying the cells in their pancreas, which are responsible for creating insulin. This is why it is called insulin-dependent diabetes. So what's the treatment? The use of insulin. Type 1 diabetes accounts for 5% of all diagnosed cases, and it's usually first diagnosed in children and in young adults. Risk factors include autoimmune diseases and genetics. A family history of type 1 diabetes leads an individual to have an increased risk of type 1 diabetes. Type 2 diabetes accounts for 95% of cases. So the majority of people you see who are a diabetic will be a type 2 diabetic. So healthy eating and regular physical activity can help control these complications. Risk factors include being over the age of 45, a family history of diabetes, obesity, physical inactivity, hypertension, and hyperlipidemia, also known as high cholesterol. Gestational diabetes is a form of diabetes shown in pregnant women. So anywhere from 2% to 10% of women will develop gestational diabetes during their pregnancy. Of note, only women who did not have diabetes before pregnancy can develop gestational diabetes. So if a woman is already a type 2 diabetic and gets pregnant, it is not then termed gestational diabetes. They still have type 2 diabetes. However, gestational diabetes will put women at an increased risk to develop diabetes type 2 in the future. So you'll see these are women who did not have diabetes prior to pregnancy. Diabetes management. So this includes yearly labs to include a fasting glucose and a hemoglobin A1C. A fasting glucose is a glucose level on an empty stomach, meaning you are fasting from food and drinks. Diabetics often do daily glucose checks via a glucometer, which is a machine that you have probably seen before where they prick your finger, and that is how they check to see what your glucose levels are. Daily and weekly exercise to reduce weight helps in type 2 diabetes, and maintenance of medications by a primary care physician or an endocrinologist. Endocrinologists are specialists which are phenomenal at helping diabetes. So what are some of the difficulties in managing diabetes? There is a lack of access to endocrinologists due to low socioeconomic status. This is often because specialists cost money to see. So if you do not have money, it can be difficult to find a specialist who will accept you without insurance. There's an aging boomer population which is increasing the prevalence of diabetics. There are food deserts, lack of education, and lack of access to reduced cost clinicians. So diabetes in the US by the numbers. It is the 7th leading cause of death. Roughly 60,000 people are diagnosed with diabetes each year in Georgia, and 1.5 million people are diagnosed with diabetes each year in the United States alone. The socioeconomic profile is most commonly the non-Hispanic African American, greater than 65 years old, of low socioeconomic status, and those who attained less than a high school education are more likely to be diagnosed with diabetes. So specifically, 644 counties comprise the diabetes belt. So this includes the following states: Alabama, Arkansas, Florida, Georgia, Kentucky, Louisiana, North Carolina, Ohio, Pennsylvania, South Carolina, Tennessee, Texas, Virginia, and West Virginia. This is also known as the stroke belt or the stone belt, various different names, and this is an area where these diseases have an increased prevalence compared to the rest of the United States. So here you see a SWOT analysis where you can see the health problem is diabetes mellitus in the state of Georgia. There are various risk factors and protective factors. Different risk factors include obesity and a sedentary lifestyle, lack of education, age, and race, whereas protective factors include exercise, healthy food choices, and employment. Direct contributing factors include increased access to fast food, older age, which is an increased chance of chronic health issues, and traditional diet choices, because in the South, we love our soul food. Direct contributing factors for protective factors include the ability to exercise given current physical status, lower caloric intake, and ability to pay for treatment and medications. So some indirect contributing factors: lack of access to healthy food options, the aging boomer population, the social stigma for declining food because you don't want to be seen as rude by your elders, especially here in the South, access to parks or gyms in neighborhoods, lower rates of obesity, and access to education, clinics, and medications. So let's talk about diabetes in Georgia, the diabetes belt, like I mentioned earlier. So the death rate due to diabetes in Georgia is higher than the national average, with Georgia having a death rate of 22.27 and the national average being 20.95 individuals. And this was found in a study done by Emory's Public Health Department. 14% of individuals in Georgia have already been diagnosed with diabetes. You can see I mentioned again, it also corresponds with the stone belt and the stroke belt. However, diabetes is not dispersed equally throughout Georgia. So Columbus and Valdosta have a higher prevalence of diabetes. There's a higher prevalence of African Americans in the diabetes belt compared to the rest of the country. So in the diabetes belt, there's a 23.8% prevalence of African Americans, and in the rest of the country, there's an 8.6% prevalence. So one could argue, is this due to slavery that most of the African Americans stayed in the South and did not migrate north? We don't really know, but the numbers do show the increased prevalence. So the fight against diabetes in Georgia. Here I chose to look at two specific groups which are doing work with diabetes. So I chose REACH, which is the Racial and Ethnic Approaches to Community Health, and DeKalb. The REACH program works to implement nutrition and physical activities through its Fresh on DK mobile farmers market. It allows customers to use their SNAP benefits, thus combating against the cost of fresh fruits and vegetables. During its first 2 seasons, the mobile market reached greater than 130,000 African American residents in target areas. So DeKalb, for those who are not familiar, is an area in Atlanta, Georgia, with Atlanta being the capital of the state of Georgia. So in Atlanta, there is Morehouse School of Medicine. They also did a REACH program, which identified food deserts in the community. So a food desert is kind of described as this area where healthy food choices are not available. So it's often characterized by corner stores or fast food places, not places with open markets where you can get fresh fruits and vegetables. So it conducted a community health needs assessment, which determined that corner stores, which were prevalent in the areas, did not offer healthy choices. So corner stores, also kind of known as gas stations, things like that. So they often do not offer, your fruits and your different vegetables and things that you may see. They often offer junk food or different things like that. In November 2016, these stores are provided with exterior signage for the Health Corner Store Initiative, which showed they offered healthy options and budget-friendly recipes. It's not enough to offer the options if you're not going to tell people what they can do with the options. So, okay, sure, I give this family loads of fruits and vegetables, but do they have recipes to know how to cook them? So COVID-19 versus coronavirus. So COVID-19 is a specific form of the coronavirus called SARS-CoV-2, whereas coronavirus is a handful of diseases under the surname coronavirus. Management of COVID-19. So treatment of COVID is broken down between out-of-hospital treatment and inpatient treatment. Outpatient treatment often includes the use of steroids such as Decadron and antibiotics if a superimposed infection is present, such as COVID pneumonia. Superimposed meaning occurring at the same time. And there are a variety of medications that have come on the market to treat the side effects of COVID, such as remdesivir. So COVID and diabetes. Diabetes is a common comorbid condition, but it is not suggested that the diagnosis of diabetes leads to an increased risk of infection. However, presence of diabetes does increase the risk of mortality in patients who have COVID and diabetes together. So what this is saying is not, oh, I have COVID and then I'm going to get diabetes. It doesn't say that. It says, if I'm a diabetic who then gets COVID, mortality is 3 times greater in that situation. So complications of COVID and diabetes. Steroid use in diabetics will lead to increased glucose levels, thus giving patients harder to control blood sugars. That can lead to a whole other host of health issues such as diabetic ketoacidosis or HHS or different things like that, often leading to further hospitalizations. There's also a stigma against vaccination for COVID-19, which I know all of us have seen in the news, on social media, within family, friends, church groups, different things like that. There's also the inability to attend doctor's appointments due to increased COVID restrictions. I personally work in an emergency room, and we had many patients who would come in saying, well, I couldn't get an appointment with my primary care physician due to the COVID restrictions, so now I'm here. And by the time they come to the ER, they're pretty sick. And these are my references.